My name is Ceren and I'm a 4-year pediatrics resident at this hospital. I would like to start by thanking European Pediatric Association for giving us this opportunity. And other than that, I think that knowing a subject and being able to tell it are two very different things, and our instructors were excellent at teaching us all the subjects, and I would like to thank them also. In this course, we learned some other stuff that were not in other courses. For example, we learned how to how to insert a chest tube and how to manage cardiac dysrhythmias, and we learned how to approach the trauma patient. Maybe you know, but maybe you don't know, in our country recently there was an earthquake that took place and it affected 10 different cities. And I think that as a pediatrician, we should know how to insert a chest tube because we might not be able to call for a pediatric surgeon all the time. And in case of an emergency, I think that we should know how to do it. And in this course, we learned it both theoretically and practically, how to insert a chest tube. And now I feel more confident, and if there's an emergency, I think that I will be able to manage it. Other than that, normally in Turkey, some hospitals do not manage trauma patients in pediatric emergency care. And in this course, we learned how to manage a trauma patient. I think that it was very educating for us. All in all, for me it was a very educating program, and I would strongly recommend all the other pediatric residents to come and be a part of this course.
Hi, I'm Dr. Rüya from Istanbul University Cerrahpaşa. I would like to thank European Pediatric Association for this great opportunity, and Professor Vural and Professor Şevketoğlu for this great course. In this pediatric emergency and critical care course, there were some practical sessions and lectures. Some of them were like routinely needed and taught lessons, for example, basic life support and pediatric shock management and airway and ventilation. On the other hand, there were some other lectures that we are not used to, for example, pediatric trauma and ultrasound. In these courses, we learned how to insert a chest tube and how to insert an interosseous line, and also we get to do a needle cricotirectomy. We had some mannequins for these procedures, for the practical lessons. And also for me, the star was ultrasound. We get to use the ultrasound and learn how to use it, and where to look at and what to see, what's normal and what's not normal in a pediatric emergency patient. And I now feel confident in recognizing pneumothorax and hemothorax and bleeding and also pneumonia with the use of ultrasound. And I would like to thank all the instructors. They were so active and willing to teach, and they were easy to ask questions. And there were some like fun quizzes during the course and some knowledge tests at the end. And I would recommend this course to all senior residents and also pediatric specialists. Thank you.